My name is Dr. Peter Grossman. I'm a plastic and reconstructive surgeon, and my practice is divided amongst what most people associate plastic surgery with. I do a fair amount of cosmetic surgery, but the great majority of my practice is related to the burn injured patient, both taking care of patients who are acutely injured as well as dealing with reconstructive surgery. I said, well, if this is that easy harvesting skin grafts, what about excising eschar, excising dead tissue? As it turned out, it works even better for harvesting, or rather for excising eschar than harvesting skin graft. And to me, that is the added benefit and perhaps the best benefit of this instrument. I can very easily remove unhealthy tissue. And as opposed to the standardized method of using a Watson knife or a Weck knife, where you're making this back and forth sawing motion, you have a much smoother cut. So your wound bed that's left is much more even, much more contiguous, less chance that you're going too deep in one area. Sometimes when you're cutting in a saw-like fashion, you have a staccato type of residual in the wound bed. And in those areas where you've taken more than you need, you'll have a worse outcome. And that really is what we're trying to do, is get the very best outcomes. The other thing that I noticed is how much easier it is to use. The ergodynamics of using the amalgatome is smooth, it's simple, there's less physician effort. It's a lot more independent, that you can be able to handle an instrument by yourself without necessarily having an assistant. And if you have an assistant, it's even easier then. To me, once I started using the amalgatome as an excisional tool, I could not go back to what I felt was the archaic way that we were doing, and then what most people tend to still think of as standard, and that's using a sawing motion with a Weck or a Watson knife. To me, that's using an abacus when you could use a calculator. It's antiquated. It's not where we should be. It's not where the future of burn surgery will be.